Organizations are always changing to meet the needs of customers and employees. To ensure success, organizations would do well to seek help from leadership consultants like Brent Garrison, author of Leadership by the Book, Lessons from Every Book of the Bible, and Peter Scherzo, author of The Emotionally Healthy Leader. Or reach out to consultant groups like the Ritz-Carlton Leadership Center and the CEO Forum. What sets these leaders apart is their focus on servant leadership. Among the variety of useful leadership theories and models, servant leadership focuses on the follower, and anyone can learn to be a servant leader. Servant leadership is embedded in the practices of the YWCA, whose mission is to eliminate racism and empower women. Rather than simply providing emergency shelter, the YWCA provides each woman with a shelter advocate. These advocates are committed to empowering women as they are guided in discovering local resources to find housing, food, and transportation. The shelter also provides the women with a job coach. This job coach is committed to the personal growth of the women by encouraging them through the process of getting a GED, appropriate identification, filling out various applications, and preparing them for interviews. In addition to providing social activities, the YWCA has a health coach. The health coach is a registered nurse and a certified faith and community nurse who provides education, completes physical and spiritual assessments, and assists with medical referrals. In addition to using persuasion and empathy when coaching the residents, the health coach also works with the staff. The registered nurse provides the staff, volunteers, and nursing students with education related to racism, homelessness, and trauma-informed training. In addition to being committed to the YWCA residents' personal health and growth, the staff members at the YWCA are taught the importance of balancing empathy, providing time to listen, and encouraging independence to improve confidence and build a healthy self-esteem. The YWCA provides a yearly impact report which adequately supports how servant leadership principles have had a positive impact on the women and children they serve. In 2018, the local YWCA provided 23,362 nights of shelter, served 1,375 individuals, provided services for women escaping sex trafficking, domestic violence, and homelessness. In addition, 273 medication errors were prevented. 73 walk-in clinic visits were averted. There were 985 one-on-one education and employment planning sessions. 72% of women increased their education and/or income level. 44 women found temporary housing. 22 women found permanent housing. And 187,425 hours of childcare was provided. In 2017, the YWCA began a medical respite care program that reserves 2 beds for women that are too ill to recover on the streets, but not ill enough to be in the hospital. In 2018, the YWCA received the Willie J. Mackey National Medical Respite Award for the impact this program had on homeless women. Even with access to community resources, housing for women and children escaping domestic violence, sex trafficking, and homelessness was a barrier until 2015, when the YWCA developed a strategic plan to expand supportive housing. The following year, Pastor Joel Branco reached out to the YWCA to share his vision of using a vacant lot owned by his church. With persistence and dedication to building a community that fostered growth and opportunities for unhoused women and their children, the YWCA was able to raise $7.1 million to fund Grace Garden. Grace Garden has 30 apartments ranging from single to 4-bedroom units. The units are fully furnished and include a welcoming basket, bedding, and supplies for the children. The complex will continue to assist women as they transition by providing on-site staff, a community room, an exercise room, a playground, a garage, and a patio area. Grace Garden is adjacent to an elementary school, church, Walmart, public transportation, and several entry-level jobs. The YWCA has done well to create a safe environment which is careful to avoid further traumatization, free of judgment, and empowers and engages women through the implementation of servant leadership. Although Sanford Home Care serves a more diverse population of clients, the impact servant leadership can have on the department is evident. At the start of services, home care clinicians are required by government-regulated policy to document a client's physical limitations and health, and then set goals that will aid in the improvement of the client's health and/or physical limitations. Clinicians would be likely to assist the client towards meeting the goals if the servant leadership principles of listening and awareness are used. In addition to the client benefiting from servant leadership, the home care agency would also profit. The reimbursement for services provided is based on a model produced by the Centers for Medicare and Medicaid Services. The Home Care Prospective Payment System bases the reimbursement an agency will receive on how sick a client was to begin, how much they improved, and the number of visits provided. Starting January 1 of 2020, implementation of a servant leadership principle will be essential. CMS will be using a new reimbursement model called Patient-Driven Groupings Model. This model will require improved collaboration with clients. Furthermore, clinicians will need to communicate better amongst each other and have better foresight into clients' needs. With implementation of the servant leader principle of conceptualization, leadership will provide the department with clear goals and can increase the opportunity to have more care conferences on complex clients. To be effective at implementing servant leadership principles in an organization, leadership needs to balance making a positive impact on the organization and within the community.